Hello all. Today's lecture is about postmortem changes. The changes that occur after death can be classified into three. The first one is the immediate changes after death. Second is the early changes after death. And third one, late changes after death. The immediate changes after death are of three types. That is mainly stoppage of function of nervous system, stoppage of respiration, and stoppage of circulation. That is, all the vital functions are lost. The early changes that occur after death includes changes in the eye, changes in skin, cooling of the body, otherwise known as Algor Mortis, Post-Mortem Caloricity, or otherwise known as Rigor Mortis, and changes that occur in the muscle. And lastly, changes in body fluids. The late changes that occur after death includes putrefaction or decomposition, adipose formation, and mummification. First, we look into the immediate changes that occur after death. The permanent and complete cessation of function of brain and subsequent flat electroencephalogram. The stoppage of brain function leads to insensibility, inability to move, dilatation of pupils, loss of reflexes, loss of muscle tone and muscle responses, and finally, flat electroencephalogram. Earlier, these changes were considered to be constituting death, but these changes may also appear in vagal inhibition, epilepsy, narcosis, and electrocution also. Second is the permanent and complete cessation of function of heart and flat electroencephalogram. So the stoppage of cardiac function is evidenced by, that is the evidence of stoppage of cardiac function is three. That is absence of pulse and absence of heartbeat on auscultation for more than 5 minutes and flat ECG. Historically, some tests like Magnus ligature test, Icard's test, diaphanous test, and fingernail test were also used to test presence or absence of circulation. But nowadays, these three evidences are used uh, to record the stoppage of cardiac function, that is absence of pulse and absence of heartbeat on auscultation for more than 5 minutes, and flat electroencephalogram. The third one is the permanent and complete cessation of function of lungs. The stoppage of respiration for more than 5 minutes, as evidenced by auscultation on the apical lung lobes or directly on the trachea, is considered as a sign of death. So we have to auscultate for more than 5 minutes to uh, evidence the stoppage of respiration. In the earlier times, mirror test, feather test, and Winslow test were also used to test the presence or absence of respiration, which is nowadays not used. The early changes that occur after death are mainly the changes in the eye, changes in the skin, cooling of body, otherwise known as Algor Mortis, um, post-mortem caloricity or livor mortis, and the changes in muscles after death. First, the changes in the eye. First, the reflexes are lost. That is, abolition of pupillary as well as corneal reflexes will happen. Then the pupils will be dilated and fixed, and there is fall of ocular tension. You can see the picture which depicts the changes that occur in the eye after death. The first one is the loss of corneal reflex. Second is the pupils are dilated and fixed, bilaterally dilated and fixed. Third one is the fall of ocular tension. These are the most important changes. These three are the most important changes that occurs in the eye. So coming to the slide, the reflex, there is abolition of pupillary as well as corneal reflexes. The eye loses its luster in cornea. The cornea becomes dry, hazy, hard, opaque, and lusterless. Uh, Firstly, this will be a temporary change which occur after 15 to 30 minutes of death, but it can be washed away. And this change, if becoming permanent, this occur after 10 to 12 hours of death. And sometimes, or very rarely, these changes in cornea may be present even before death. Example, in cases of death due to uremia, death due to narcotic poisoning, death due to cholera, etc. Or may not occur for some time after death in case of cyanide poisoning and carbon monoxide poisoning. Coming to this picture, you can see in the first picture the hazy cornea. In the second picture, there is wrinkling of cornea. The third picture, we can see a central depression over cornea. And in the last picture, you can see the cornea becoming opaque. And there is also bulging of eyeball due to decomposition. The next change happens in pupils. The pupils will dilate bilaterally after death. Normal size of pupil is about 5 millimeter, and you can see in the picture the pupils are fixed, bilaterally fixed and dilated. But the pupils are for 1 to 2 hours, they respond to miotics as well as mydriatic. That is, pupils will dilate as well as contract according to the substance we introduce into the pupil. After 2 to 3 hours, any pressure on the pupils changes its shape to oval, triangular, or polygonal. That is, we can alter the shape of the pupils. The next change occurs in the intraocular tension. Usually the intraocular tension or intraocular pressure falls after death, and therefore the eyeball sinks into the orbit. The normal intraocular pressure is about 14 to 25 millimeter mercury. Immediately after death, it falls to 12 millimeters of mercury. Half hours after death, it becomes 3 millimeter of mercury, and after 2 hours the intraocular pressure falls to 0 millimeters of mercury. In the sclera, the changes are that if eye remains open after death, there occurs deposition of dust on sclera, which leads to a brown pigmentation known as the tachynoid. You can see in the picture in the top right corner, a picture of tachynoid, that is deposition of dust on sclera leading to a brown pigmentation. This occurs only if the eye remains open after death. The changes that occur in the retinal blood vessels include a change known as Kevorkian sign or railroad appearance. In a living person, the retinal blood vessels are seen on ophthalmoscopy as a continuous line. This is the most important change in eye to calculate the time since death. That is, the change in retinal blood vessel is the most important change in the eye to calculate time since death. So on ophthalmoscopy, 1 to 2 hours after death, the retinal blood vessels becomes a dotted line, seen as a dotted line. This is known as Kevorkian sign. And in 2 to 3 hours after death, it becomes segmented. So it is known as railroad appearance. And after 3 hours or more than 3 hours after death, the optic disc becomes pale. These three changes, Kevorkian sign, railroad appearance, and optic disc becoming pale, can be established by examining with a ophthalmoscope. So this is the most important change in the eye to calculate time since death. That is early change. That is depending on early changes in the retinal blood vessels, we can approximately estimate the time since death. The changes in the electrolyte levels in eye that after death there is increase in levels of potassium and ascorbic acid in the vitreous humor of eye. Second early change is the changes in skin. First, there will be color changes in skin. That is, after death, the skin becomes grayish white in color. After decomposition, the grayish white turns to greenish discoloration, which is due to the formation of sulf-methemoglobin. The second change is loss of translucency. That is, after death, the skin loses its translucency and skin becomes opaque. And this can be confirmed by the examination of webs, finger webs under light. The third change is loss of elasticity. That is, after death, there is loss of elasticity of skin. So the post-mortem wounds don't gape. And also the area pressed becomes flattened. The fourth change is in the lips. The lips become dry, hard, and brown in color due to drying. The third important change is cooling of the dead body, that is Algor Mortis. We have to study this change in detail, and this change is usually asked for your university as well as semester examinations. Frequently asked for university examinations. The definition of cooling of dead body is that after death, the dead body behaves like an inert substance, and therefore, if atmospheric temperature is very low, the body loses its heat by four methods, that is, conduction, convection, radiation, and evaporation. The reason for this is to attain the atmospheric temperature, that is, the body ultimately cools. If the atmospheric temperature is higher than that of the body, no cooling of that body occurs. As you all know, the normal body temperature is 98.4 degree Fahrenheit or 37 degrees centigrade, and a fall in body temperature by more than 10 degrees centigrade is a sure sign of death. How will you measure the temperature in a dead body? Usually, the temperature is recorded using a chemical thermometer containing alcohol, being about 25 centimeter long and graduated from 0 to 50 degrees centigrade. The chemical thermometer is inserted about 10 centimeter deep in rectum. We have to measure the rectal temperature. So the chemical thermometer is inserted about 10 centimeter deep in rectum or vagina or nose or ear or under the liver, which is kept there for 2 to 3 minutes and is read. And its temperature is read when the thermometer is still inside the area. The chemical thermometer is not inserted in rectum in cases of sodomy. Sodomy means anal intercourse. The rectal temperature is not recorded, but temperature from vagina, or nose, or ear, or under the liver may be taken. So, how will we calculate the time since death from from this measurement? This is by a formula. Time since death is equal to normal body temperature, that is already known as 37 degrees centigrade, minus observed rectal temperature divided by the rate of fall of temperature per hour. So we have got the normal body temperature as 37 degrees centigrade. We have our rectal temperature recording. Now we have to know what is the rate of fall of temperature per hour. For that, there are varying opinions about the rate of cooling of dead body. The most widely accepted view or opinion is that the rate of cooling in India is zero point 0.5 to zero point 0.7 degrees centigrade per hour, so that body attains the atmospheric temperature in about 12 to 15 hours. There is another opinion or another view that cooling is faster in its initial period when the temperature difference between body and atmosphere is maximum. So in the first 2 to 6 hours, the rate of cooling is 2 to 2.5 degree Fahrenheit per hour. Next 6 hours, rate of cooling is 1.5 to 2 degree Fahrenheit per hour. And later on, rate of cooling is 1 degree Fahrenheit per hour. So the external surface cools in 12 to 15 hours, while the interior takes about 18 to 24 hours to cool, and it may take up to 40 hours in obese persons. Another view or opinion is that body cools by half of temperature difference between body and atmosphere every 2 hours, and whole body cools in about 12 to 15 hours. The fourth opinion is that at a particular place and at a particular time, the rate of cooling of dead body can be known by taking two consecutive readings after 1 hour intervals. So the two difference between the two consecutive reading is the rate of cooling per hour. Then what is the approximate time required for cooling? So body starts cooling after 1 to 2 hours of death and attains the atmospheric temperature in about 12 to 15 hours depending on the atmospheric temperature, while the internal body parts takes about 18 to 24 hours to cool. Initially, that is before molecular death happens, the rate of cooling is very less. So you can see in the picture, this is a sigmoid shaped curve. The x-axis is plotted as time since death in hours, and the y-axis is plotted by temperature. So in the initial phase of time since death, there is the rate of cooling is very slow. So there is a flat curve, that is fall of temperature from the surface. Then after some time, after uh, about say uh, 12 hours after death, the fall of temperature from core of cadaver happens very fast. Then after 12 hours, the cooling is very less because the body temperature is almost close to the environment. So this curve. So in the first 8 hours, fall of temperature will be from the surface, which is very slow. Then after that, 8 to 12 hours, the cooling is very fast, and after 12 hours, the cooling is very less. So if we plot the temperature in a x and y axis, we will get the shape of a sigmoid curve. That is the shape of an inverted S-shaped curve. Now we have to look into the factors influencing cooling of dead body. First is about the age. The body of small children and elderly cool faster because of less muscle mass. Second factor is the general condition of the body. So a lean and thin body cools faster, and the contrary is that an obese person cools slower. Next factor is sex, that is usually body of male cools faster. Another factor is about clothing. A clothed body or body lying in bed cools slowly. Next factor is about the atmospheric temperature. Rate of cooling is directly proportional to the temperature difference between the body and temperature. If the temperature difference of the body is large, cooling is fast. And if the temperature difference between the body and atmosphere is low, rate of cooling is slow. Next factor is the type of death. That is, in case of sudden death, that is death occurring very rapidly, cooling will be slow paced. And in death due to chronic diseases, cooling is faster. There is another condition known as postmortem caloricity. In this, instead of cooling, body may gain heat for some time after death. That is called postmortem caloricity. We will learn about postmortem caloricity later in the slides. The next factor is about the surroundings. Cooling is faster if there is strong air currents that are passing over the dead body, and cooling is faster in case of dry weather. That is, the temperature difference between the atmosphere and the dead body is very large. So the cooling will be faster in dry weather. The rate of cooling in water is to air is to buried is equal to 4 is to 2 is to 1. So cooling is fastest in water and slow in a buried body. And if the body is at sub-zero cavities, body become hard due to formation of ice in cavities and blood vessels. And the sutures in the skull may also separate. Now, regarding the medico-legal importance of Algor Mortis, cooling of body or Algor Mortis is a sign of death. And the time since death can be approximately done, and this is better calculated or approximately calculated in cold countries. And postmodern caloricity may result in some conditions. So we have to learn about what is postmodern caloricity. Postmortem caloricity is that for initial 2 to 3 hours after death, that body may gain heat. However, later body cools as routinely. What are the reasons for postmortem caloricity? First and foremost reason is about metabolic processes or anaerobic processes or some chemical processes that continue after death, and this liberates heat, which is known as exothermic processes. So for the initial 2 to 3 hours, the dead body may gain heat uh, because of the presence of some anaerobic processes which emits heat or liberate heat. Bacterial or viral activity continuing after death may also lead to heat production. Then death associated with extreme muscular activity like convulsions, tetanus and strychnine poisoning may also lead to postmortem caloricity. The heat regulatory mechanism of the body severely affected before death, that is death occurring from sunstroke, pontine hemorrhage, etc., also shows postmortem caloricity. So the examples for the circumstances for postmortem caloricity include first death due to heat stroke, then death due to lightning or electric current, death due to heat or flames, that is burns, then pontine hemorrhage, asphyxial death, especially suffocation, death associated with extreme muscular activities, like in case of tetanus, convulsions, etc. Death due to poisons like alcohol, carbon monoxide, strychnine, etc. Some viral infections like rabies. Then bacterial infections like pneumonia, meningitis, peritonitis, liver abscess, cholera, tetanus, typhoid, nephritis, etc. And as well as in case of very high atmospheric temperature, that is death due to sunstroke, etc., there can be postmortem caloricity. So this concludes today's lecture.